Hello, good evening, Johar and Pranam to all of you. So I welcome you all on 24th episode of this amazing program, the podcast program that is the Gyan Pravah. My dear friends, this whole program is brainchild of none other than but our dynamic and charismatic President Fogsi, Dr. Sunita Tandulwadkar, madam. I know absolutely from last 24 days, every day, you have know each and everything about Madam. So I will not repeat it. But I just want to say what has Madam has done in last 1.5 months about the achievement, about the milestones, and the if I will, ask and tell about all the achievements, I think the whole day is less, even the achievement of these 2 months only. So if we start from the 24th episode of the podcast to two presidential conferences at Andaman and Nagar district of Maharashtra, we have phenomenal projects like Sampurna. We have already finished more than 10 Sampurna CMEs. We have mega projects going on. We have a lot of know your number, then the Anudha program. We have a Arogya Yog Yatra. And ma'am, I'm really so blessed that you are still in a Yuva Foxy North Zone and you take your time to come here as a live for you to bless us and for your words. So thank you so much, ma'am. So starting from the Arogya Yog Yatra at Tirupati, then we have at Rishikesh, we have at the 4th of February, we have launched the 2 TK Zindagi Ke, and it got a national wide news. All the major newspaper and all the major news houses published it. More than 100 Foxy Society has actively took part, and a number of students and number of women are get the tika of HPV vaccines. Ma'am, this is not the end, but this is basically the starting. We have a Nirmal Banaras Abhiyan, which ma'am will launch in the next month at UPCon. Ma'am has Arogya Yatra at Haridwar. So, ma'am, I have short of my word what the tremendous work, and ma'am, I am really honored, and ma'am, it's really I have fortunate that I am working under you, under your able leadership, under your charismatic leadership. So thank you so much, ma'am, for all the blessings, for all your projects, and for all your vision, for all your leadership, ma'am. And thank you so much. And before we are going to the podcast for today, now I would like to introduce in very shortly our faculty for today, Dr. Raj Shekhar Brahmabhat sir. What I consider him as a Bhishma Pitama of sexual medicine in India, and definitely he is. The total life total the career span from 4.5 decade long. At the time he started the sexual medicine practice, when people are scared of talking of this topic because of the taboo. Sir is associated with so many conferences, so many workshops. Sir is associated a lot of awards and lots of textbooks in her credit. So thank you so much, sir, for accepting our invitation. And over to you, Sunita ma'am, for your kind blessing, for your words, and for start this program. Over to you, ma'am.
Thank you, Apurva. Thank you for 40 days of a journey of Foxy 2025 team. Dr. Rajshekhar, you must be wondering, is this a woman who is doing in 40 days innumerable conferences, innumerable podcasts and projects, and a number of meetings? No, sir. Foxy doesn't belong to only one president. I have my 30 cabinet ministers, the chairpersons. They are the one who are making every day their podcast one of the best podcasts they want in an entire month. 30 committee chairpersons have been given 30 days. So if Apurva is coming on 22nd, Apurva 22nd, right, today?
Yes.
Yes, ma'am.
22nd, he will be on 22nd of every month, sir. It may be academic or non-academic, maybe social worker, philosopher, spiritual guru, anyone who can add on to our knowledge. It will be benefiting the entire society because it's on a social media, not necessarily only Foxians can reach to this podcast, the entire world, not only the medical fraternity, but non-medicals also can hear. So this podcast is getting a huge appreciation. I have so many Foxians saying at 8 p.m. every day, they log in. If they miss and they were interesting, they will ensure that they will hear. So thank you so much, Apurva, for getting Dr. Raj Sekhar Brahmavat. We were hearing about you for decades. We wanted to know the personality, but today you are getting him to be interviewed. That will be one of the most interesting to know about his journey or what topic you are going to. We will all be watching you all. Sir, our protocol is you both are only in the dialogues while I log in from another link which is viewed by everyone. So it's my pleasure to be in one frame with you, to know you, and definitely would like to meet you in person as well, sir.
The same thing is with me, madam. We say in Sanskrit, Nari to Narayani. And whenever Dev cannot do, they go to the Shakti, and you are the Shakti. And where they say, Yatra Naryasu Pujyante Tatra Devta Ramante. So I think rightly you are at the helm of affair, and I'm also equally feeling I'm on the seventh heaven, to be honest with you.
So
When
sweet.
Apurva told me, and I said, it's a wonderful opportunity. I will take out my time from busy schedule, but this is a Apurva avsar for me. It is na bhuto na bhavishyati with you and Apurva on other side. And before we talk the dialogue, let me once again say that I'll be very happy if they give you Padma Shri or Padma Vibhushan. You deserve it, madam. And when you
Absolutely,
get it, just
absolutely,
remember
absolutely,
me. The first
absolutely, sir.
person to tell you was Dr. Raj Sekhar Brahmapat.
Thank you.
And Apurva, today's talk I would like to dedicate to none other than Dr. Parag Patil, who was a bridge between sexual medicine and OBGYN. And
Okay.
after him, three people, three musketeers, I call them. One is Madan Kamble. Madan is the name of Kamadev. Second is Neerav Jadhav. And third, none other than Apurva. So I'm over to you. I'll be open.
Okay.
Ask any
Sir,
question. And once
just
again, I thank you, madam, for your presence. Keep it
Thank
up.
sir,
you.
before we start, just what you have said, na, it's a Apurva Apsar. This Apsar is due to Sunita ma'am.
I agree.
Absolutely. And not I am. A lot of other people are fan of ma'am. And recently, the Chandrapur MLA, and yes, ma'am, I think you remember that. Yeah, the Sudhir Bhau has so much impressed with ma'am that he willing to give support to all the Sampurna and Know Your Number project of ma'am. So
Yes, sir.
the list of fan following of yours, ma'am, is really very long.
And
Thank
I,
you.
I would like to request you every day, ask somebody you dictate your everyday's work, and it will be a really, I think, eye-opening thing. Please kindly start doing from today only.
Thank you,
Thank you,
sir.
madam.
I
Thank you.
will.
Thank you so
And
much, ma'am.
I know, sir, how busy you are. Only thing I realized is you are very humble, sir.
No.
So thank you for being there. And
Teaching is my passion, and sexuality is my religion. So, like Kumbh, where you will be happy to know when I went to Kumbh, Prayagraj people came to know. They say, "Sir, we would like to have your talk psychiatrist department in IMA, which is 100 years old." And they had a difficulty, and then they got me over there. The best part was next day in the morning, around 1 o'clock at the noon, they say we got three cases in the psychiatric OPD. So you people are the first people, gynec people and OBGYN, to get the cases of sexual medicine. And I was happy that Madam Motasha and Mahapatra had already told me that when they heard me about 15, 20 years back, they said we should start learning about the sexual medicine. And today, it is under your leadership we are doing it.
so
All the
nice.
best for the
No,
coming
Thank
year.
you. Thank you so
And
much.
anytime you need, please don't hesitate to call me.
Thank you, sir. Thank you.
Thank you so much, ma'am.
And
Thank you so
Apurva,
much, ma'am,
I'm
for that.
sure you
Yeah.
are going to rock, and the
Thank you so much,
podcast will
ma'am.
be one of the best podcast of the month. Thank you.
Thank you. Thank you so much, ma'am. Thank you so
Thank
much, ma'am.
Yes, Apu.
So, yeah. Now, after the blessing, sir, when I know you from half of the decade, and I got through your, sir, your practice, your life, and everything. So when I got through your life history, your career, so I was wondered that before 4.5 year decade, when people are even don't talk about the sexuality, you have just shifted your practice from a general physician to the sexually full-fledged, a independent subject, the sexual medicine. So, sir, what actually inspired you first thing, and the now the people like me, or many people like me, they are very scared of taking this sexual medicine as a single subject. So what information you want to give them, that what importance is the sexual health in our day-to-day practice, and for the doctors as well as the patients? Over to you, sir.
Very right. And what is the title of your today's talk?
Yeah, it is the sexual health. Is it is really important?
Right. Excellent. That's an excellent question you have put. And that is a to be or not to be. And I can tell you, your first ball is a googly ball. And आप हाले दिल सुनने के ना सुने हम सुनाएंगे. So I was a very dull student coming from a Gujarati vernacular medium, not understanding English. And I passed and I became a general practitioner. In family practice, I was doing wonderful over there. In fact, I became the first international conference which was there. I was a chairperson. And what me, Dr. Ramnik Parekh and Dr. Jimulia did, till today, those are the milestones in the family practice. Interestingly, there was a one big conference over there, and that was on a subspecialty psychiatry, which was hardly being taught at the undergraduate level in 1970s, 60s and 70s. So I was asked to speak from the psychiatric problem in general practice. Now, during those days, those Kodak carousel slides were there. We are not lucky like this today. With the Google and other things, you get within a minute. So what happened over there? That to make a slide, I had always an artistic inclination. And the top, not only India, but the Asia psychiatrists were there. And we were all there, and I was the only family physician. And then I went around to waste paper, those shops which are there, Kabadi wala or Pasti wala, we call it. National Geographic लिया, उनमें से फोटो निकाला, slides बनाया. First and last time in my 55 years of career, once more हो गया. Same year, 1980 में, there was a conference in the Indian Medical Association, Bombay branch. And Dr. C.S. Agrawal was one of the pioneer, like A.P. Pillai. So he was presented on sexual medicine. I just went with a curiosity. And believe me, he didn't have a slide, so he showed the calendar and showed the ling and yoni. And he said, this is a phallic symbol and this is vagina. And I was shocked because I was praying right from the childhood. And it was a first shock to me. And in the same year, Dr. Prakash Kothari heard, and the first national conference was coming, and he requested me, can you speak on sexual problem in general practice? And that's how I started. After 2 years, there was another conference in Mumbai. He said, what would you present? I said, Kama Sutra. Believe me, I had never read, even after my marriage, Kama Sutra. He said, wonderful idea. We can have an ancient yet modern. So I went down, purchased Kama Sutra. And from that time onward till today, I must have read 100 times. And every time I dig out something amazing thing over there. And then from here, the focus goes to 1985 World Conference of Sexology in Taj Palace. And in a 3,000 square feet area, 19 cubicles, I presented first time sexual medicine. How? Right from the Vedic period till the Britishers left. How it was seen in Indian scenario in paintings, sculptures, day-to-day object and manuscript. We never thought it was a taboo. What you are saying is a very correct word. We were very open about our sexuality. And on the last day, Mulkraj Anandji came and he put his hand on my head and he said, if I will leave my son tomorrow, you are there on this earth. And the best part was John Money, the one of the topmost sexologists. He removed his ring, which was of a phallic symbol, and he presented to me. So the
Wow.
1985, this conference was one of the best conference, and it was a milestone in my life, you know. And after that, there was a focus program in Doordarshan, only black and white, 1 hour. Clive Davis, world president, Saroja Aga Khan, expert, Dr. Prakash Kothari, and myself. We were asked to speak for 1 hour on sexuality education. And can you believe we were told not to use the word penis, vagina,
Okay, sir.
intercourse, and masturbation? Today, if you tell me, it will be very difficult to do that. And after doing that, I went to my place, sat down like in a
Wow.
hotel, any hotel, you come out of the campus. In that much area, I got 7 couples, 4 of them were a regular patient. And they said, sir, we want your sexual problem. I said, how do you know that I know? He said, we saw you on the TV. Then I realized that this particular area needs, and quacks were flourishing everywhere. In allopathy, people had idea. This topic was never taught to us. Nobody was ready to share. And I said, this is the area I should jump. And in Andheri Medical Association, we were sitting in a meeting. And suddenly I found that there were 10 gynecologists, 2 psychiatrists, 5 physicians, 10 cardiologists, not a single sexologist. So I decided to jump into this area. And believe me, initially it was so tough to leave for family practice and join there. Those who were not the internet or Google days, everything is available. Even a small piece of paper, it could be seen that it is a erotic, not even, it's a pornographic, and you could be behind the bar according to the Indian law. And nobody, and I was a laughing stock of my own association. They say, अपना sexologist आया और घर वाले बोले 2-3 रिलेटिव, दूसरा कोई धंधा ना मिला तो इधर. And from there, I tell you कि हम अकेले ही चले थे जानिबे मंजिल की ओर, लोग मिलते गए और कारवा बनता गया. और if I say Robert Frost, that on the road, it diverged into 2 roads, and I took one which was a least traveled, and that has made the history.
Wow, sir. So inspiring, and definitely, sir, it's sir, really, it's an inspiration for all of us who actually really scared of taking this as a subject because of the taboo behind this and what you have exactly did कि कुछ और subject तेरे को नहीं मिला, तेरे को यही मिला. It is a
And what
laughter. Even when many of my friends are telling that you are practicing sexual medicine, you are a gynecologist. So they are actually laughing on me. So I absolutely understand when the 45 year back when you were thinking, so it is that,
well,
but you have chosen that boldly, and that's the history today. So
very
thank you so much,
rightly,
sir, for sharing that.
this is the
And
magazine
sir, after that, we
you
will
might have seen in a college days, Debonair.
Debonair.
It was like a
So all
Playboy,
of us
Indian
know, I
Playboy
am
all.
sure,
And I tell you, I was only
because
suited booted person. For 11 years, I did a sexual advisor of a Debonair. And believe me, that was when I went to Bangladesh, the senior most person of president said this was the only source of a knowledge for us. And then Dr. Vasa called me for SECRT, Sexuality, Education, Council, Research, Therapy, and Training. And believe me, we had a 16 branch, 6 sub branch, and 44 center, and 5 or 6. So, like madam, I travel all around India, right from the slums, right from the village to the rural, and the Rotary Club, and the doctors, and all the people. And the first thing I realized, what I said, what I passed through the pain, that I want to come out with the Indian book on sexual medicine. The first time, Therapy of Common Sexual Problem, a handbook. It was the first of its type in a SAARC country. And can you believe 33 people, including international people like John Bancroft, they contributed over there. And this was pre-sildenafil area, that is Viagra era. And till today, now it is out of stock. I Xerox it and or photocopy it and give it to the friends. This is what we have done. And second thing, what we did over there was human sexuality. Under my guidance, Dr. Dan Pantaki, she came out with a book. So I thought of doing this, that don't keep it to yourself, but spread it to all around the world what you people are doing. And that's what I'm proud of you. Go ahead.
Wow, sir. Wow, sir. It's really an inspiration for all of us, sir. Uh, and really, what you have said, these books and Debunar, absolutely agree. We all know about Debunar at that time when I was used to be kid or at the adolescent. That was the only book available for a authentic book on the sexual medicine.
And
So
if you
coming to the first
recollect
question,
in
sir,
the sexual
many
medicine book,
time the patients are coming with us.
I didn't get you. What was your question? Arnav,
Absolutely, sir.
what was your
Yes, sir.
question?
Sir, when the patients are coming jumped on us, yeah. So yes, sir, I'm telling this. Sir, on the very first day of the marriage, the second day they jump on the gynecologist or a sexual medicine practice, and they are saying that on the first night we are unable to perform. So, sir, what is this the first night failure? The first thing. And when we call it as a dysfunction, a sexual dysfunction. Yes, sir. Over to you.
So very correct, as I said, you are the first line where the client will come down to you. I don't call them a patient, they are clients. So what happens that if you see the book, I have written a complete chapter on first night failure. Suhag Raat has been glorified in our film. दूध लेके आते हैं, मिठाई लेके आते हैं, where they will be getting married, what will be the design, it will be destination marriage, what the dulha will wear, what dulhan will wear, who are the people invited, संगीत कैसा होगा, choreography. Nobody tell where they will go for honeymoon, but nobody tells them that what happens after they reach to the bedroom. And the boy is worried because he has to show his masculinity, and female is worried because she has to lose her virginity. So all tensions are there. Now boy has masturbated. He had read somewhere that ke jawani mein ki hui bhulo ke liye mili hai. So he's worried, he's tense, whole day tired. And literally first night they fail. And I have people who have gone to the Sun City or the best of the resort 21 days. Evening he'll take a beer and go to sleep and nothing happens and they have come down like this. So that's why if you remember Dhat syndrome and first night failure, these were all things which are of Indian origin in this book. You won't find in the Western testing. So when they come to you, first of all, now so many times just some people are lucky that they do premarital counseling, which is the right thing to do. When they come to you for the period that I want to delay my period, I'm getting married, that's the best opportunity to convert this into a goal of sexuality education. You tell them that, well, I never knew, or anybody comes to you with a wedding card, tell, well, I was ignorant in spite of being doctor. And that's true because nothing has been taught to us. And in medical college, we do not have a time to look at all these things. So once you say this, they will open up to you. And then you say, can you learn the cycle on the first day? Can you learn the piano on the first day? Can you make the dosa on first day? No, it's a learning process. So it may take a time. And first of all, you are tired. You have to get adjusted. They have whatever education they have got it in the past experiences, past trauma, sexual abuse, sometimes incest, which is we thought that uncommon, but which is quite common over there. And whatever the friends have told, and that is there in their mind. So either they do not have a proper sex education or misinformation, and there are plenty of myths. Like as I told you, masturbation myths, penile size anxiety, the size is very small. The breast size, same thing over there, Das syndrome, sex tonic, and varieties. When people when they watch the porn, they think they can continue for 45 minutes like a Superman. And here in excitement, by the time they get an erection, he ejaculates out first time. Or even in one case, it was a pre-cum or corpus fluid, and he thought I have started leaking. And then once that anxiety comes in, shame comes in, guilt feeling comes in, and then the performance anxiety is there. And once they fail, there is a fear of failure. And next time they are becoming spectator rather than enjoying. It becomes a goal rather than a pleasure. And a vicious cycle is there. And where to ask? So these are the people who are in the problem. Some lucky couple, they come immediately after the honeymoon. Some may take 1.5 years thinking that they are family planning, and then the fertility problem comes up. And that's the time you are the first person to be contacted. And as you know, till today, nothing has been taught. So we are absolutely blank. We don't know if first question they ask and then what to answer further, you do not know. Today we are lucky, very medications are there. Things are available on the internet and other things. You can go to YouTube and learn, but sometimes they that themselves can create a misinformation. So this is how you will have to take care of the client which is come. And then it's a multi-speciality. A sexual medicine consultant, gynecologist one side, andrologist, urologist other side. If there are problems like diabetes, heart problem, you need to then endocrine. So it's a combined effect. It's a multi-speciality thing. But for a working class, if you just attend few of the classes on sexual medicine, read couple of books, there are courses available. There are certificate courses and fellowship courses now available. If you can do that, I think you will be doing a lot of good services to your client. And secondly, without much of investment, you will be doing one up than your anybody nearby practicing person. So I would say you must take it up this. And I'm happy that you have today got the sexual medicine as a very important part. And one more thing, as you said that is it important? Yes, my dear friend, can you believe that recently 1974 WHO has come out with, previously they were talking about health, then psychological health came, and then the sexual health. But think that we are the country where Kama Sutra was written in 300 AD. And what did Vasayan says? He said very clearly, mark this word, a physician without knowledge of herbs. माने एक वैद्यराज जिसे जड़ी बूटी का ज्ञान नहीं है. An accountant without a knowledge of figures. अगर वो मेहता जी है अकाउंटेंट है, अगर उसको फिगर का कोई ध्यान नहीं, and a married man without the knowledge of sexual science are all useless creature. And I remember over here the words of Leo Tolstoy that man can survive earthquakes. He can bear all the tortures of soul and tormenting tragedy of the illnesses. But the most tormenting tragedy of all time is and will be the tragedy of bedroom. And I call them a silent bleeder. Nobody is there to listen to. If a girl, she gets a pain, they will come to you. If she's getting excessive bleeding, they will come to you. But if they are having unconsummated marriage, that will not surface till 1.5 to 2.5 years. So you should make it a very regular question. And for that, you have to be comfortable. How is your period? When was your last period? Do you get a heavy bleeding? How many pads you have to use it? Do you get cramps? In the same breath, you ask that how is your sex life? And then women are more open than the male.
Okay, absolutely. So you have very correctly point out, sir, because as they will usually don't come, majority of them don't come and in front of you, they are saying, I have this problem. But when you are saying, do you have some problem in your sexual life? Then they will open up. And you have correctly, very correctly point out that, yes, this is a major part. I have seen, sir, with all your blessings, when I started seeing the patient of the sexual dysfunction, patients are suffering from this dysfunction, and there is nobody to whom they are actually, taught and actually share. And I have seen a lot of broken family, the divorces, the suicide, the depression, a lot of mental illness due to the sexual dysfunction. So,
You're
absolutely, sir, this is absolutely true.
absolutely right. If a marriage on a honeymoon, if he falls down on the horse and he gets a fracture, it is accepted. If he comes and he gets a cold and he is getting pneumonia, it is accepted. But if this has not happened and girl has lot of anxiety, she'll tell her mother, friends, and then they think that we have been cheated. This boy was important and they try to, and then the anxiety still increases on the boy. So what you are saying, that's why I called a silent bleeder. Imagine in a home, a small baby gets a little fever, whole home is upset. If somebody on the road faints, good people will go and help. But here these are moving in a very help, and that is why the first thing is required is you will have to be very comfortable. And recent one of the study showed 41% of the women have a sexual problem. They have much more than the male. Male have got around 31 or 37. So you can imagine that we are missing this part. So you should make a routine, and what you do in your room, waiting room, put down some pamphlets, or you say on Wednesday I treat the sexual problems over here. And then they come down. No, it's an indirect way of telling the people. Otherwise, you should be comfortable, make it a point to ask. And whatever you can do, you help them out. Beyond that, you can always pass on to the other thing which you cannot do it.
Absolutely, sir. Absolutely. So you have very correctly point out the causes of sexual dysfunction. So, sir, when we are talking about, we are always considered as female as a passive partner. So, how important to treat the female sexual dysfunction? Number one. And when we are talking about the sexual dysfunction, sir, what your experience that is due to the male, due to the female, or due to the combined?
Very good question. I would say, first of all, I never say it is a male problem or a female problem. It is a problem of a unit. And as John Bancroft says, it's a problem of a relationship. So you cannot point it. There is nothing like an uninvolved partner. I can cite to you hundreds of cases where one is a cause and another is a sufferer. And so many times we are misled with this. If I can go on giving those examples, I don't think we'll have time to do that. But the first most important, as I said, that it is very, very difficult for a person to admit that they have a sex problem. So, and previously it was thought during the Freudian time that they have a very deep-rooted problem right from the childhood. Thanks to Masters and Johnson, Kinsey, and Helen Kaplan and others, and Bess and Rosemary, they have come out that it can be having a very simple problem. It can be a problem of today. It's not necessary that suppose if the water is not coming in your room, there may be a pipe is being repaired. You need not go to that, which is the source and what has happened and all the details. No, need not. Previously, people have spent lots of time on doing psychoanalysis, which the treatment will goes on for not only weeks, but months and sometimes years. While it can be very simple. And that's why I said, you remember this: bio, psycho, and social. So biologically, what are the problems? What are the medical problems? What drugs they are taking? What surgery they have underwent? All those things, what genetic problems are there? Psychological problem, sleep, adjustment problem. These are two people we are meeting, ideas of two people. Today's women is a liberated woman. They are alpha woman. They would like the equal share. And all those things are there. And lastly, the social problem. How much is the privacy they have got in the home? What is the joint family dynamics which are going on? तभी सास भी कभी बहुत ही अभी कई सालों से चल रही है. Because there is always a problem. And all those things they bring into the, not in the balance sheet of this sex problem, comes out in the bed, and in a bed sheet it is coming out. So it is very, very important to see that these are three areas you should remember: bio, psycho, and social. And sometimes the religious aspect also. On a religious ground, the women are trying to do this. And problems are very easy. If you follow the Masters and Johnsons, desire comes in the male first, then comes erection, then maintenance of erection, then penetration, orgasm and ejaculation as a split second, and then whether any pain was there or not. While in case of a female, desire is there or not, lubrication, which is very important, any pain while penetration, and reaching an orgasm. And do they know that there is a clitoral stimulation? And these are the small things which you will have to bring it out. So three aspects again: sex education, myths which are there doing with the counseling, and which you can do with the Plicit model, which I teach in the workshop. And last but not least, the therapy with which you can bring them out here. So I think it's very easy without putting any amount of big gazettes and other thing. You can start practicing from very next day.
Absolutely, sir. Absolutely. Very true, sir. Sir, many time whenever I have meet a lot of person who are practicing the sexual medicine like you, sir. So many times, sir, they have this thought that the violence against women, especially the sexual violence against women, is due to of not knowing the sexuality, not giving the sexual education. And many of them advocate that what you have just stated, the sexual education can be used for prevention of the violence, especially the sexual violence against women, like the rape. For example, sir, few months back, it's been almost 6 months where we have that very infamous that Arjikar incidents happened, and it started all
It's
over the medical
painful,
fraternity
painful,
and
right?
including the India and across the global. Sir, what your insight that the sexual, when we are talking about the sexuality, it's not only the treating the sexual dysfunction, it has a deep impact on the society. Sir, what's your intake on that?
Absolutely right. Sexuality, that thread is woven right from the childhood till the death. And the male, two factors are male and the female. And I'm happy to say that under CSAPI, Council of Sex Education Planned Parenthood Federation, under Dr. Vatsa started, and then I was a head of it. Today, more than 45th annual conference is going on. And I'm the only founder and surviving member. So you can see that Council of Sex Education. So the most important part is the education where parents are also involved. It's not that the only doctors. So it's a wide spectrum you have to see, and you have used the word sexuality again. I'm very happy. People nowadays, I go and see some of the school, they say we give you sex education. It is only telling them about male anatomy, female anatomy, contraceptions, and the menstruation. Even they don't talk about masturbation. While sexuality education is a different. What we say, sex is a physical act, while sexuality is a dimension of a personality. Which family you were born, which I was born, who were our friend, what was our family was conservative or very open family, which school we went, which were our friends, which was the first sexual experience, which country you stay, which is your religion, all those things. It is not what a man does in the woman or woman does with the man in a darkness for 5, 10, 15 minutes on Saturday night. It is a lifelong process. It is not only a reproduction or for reproduction. It is not for recreation, but the relationship. And these three are you have to remember. And that is why sexuality, and as you very rightly said, I'll just give one because I have plenty of incidences. I had gone to Yamunanagar in Haryana. So I was to conduct a whole day workshop. When I went there, boys were sitting on one side, girls were sitting on other side. I said, ये क्या हो रहा है? कुछ कव्वाली थोड़ा है? Then one of the girls stood up and said, no, we cannot sit, in our. The other boy said that if we are seeing even with our cousin on the road or in the garden, the moral police will come and beat us up. And the maximum problem in them was the eve teasing. And when I heard, now see, adolescent boy, hormones are pouring in, friends are talking. It's very natural that you get attracted to if you're a heterosexual, same sex, or an opposite sex if you're a homosexual. Now, this is very clear. So what they do, they want to talk. Nobody teaches them how to go and talk to the girls. I said, show me I conduct in a workshop. I said, show me how do you do. So the girls start, Lal Chadi, Maidan Khadi, and all those, hum kale hai to kya hua, dil wale hai. And if not the Munni Badnaam hui, nowadays it will be like that. Or Sheila ki Jawani. But the girl said, we are also no less. If we are 6, 7 girls and the boys passing, we say, oh, Glaxo baby, Murphy baby, Lulu, Lulu, Lulu. Then I told them how to behave. Believe me, 15 days later, I received a beautiful letter which is in my possession from the principal of that college. He said, what wonders you have done. Now, boys and girls, they are meeting, they are respecting each other. They sit in the canteen, they exchange the notes. So we have to teach our youth. It is not
Absolutely,
their
sir.
fault. When I went to Manipur, Imphal, 4:30 it is dark. There is no, at that time, more than 25 years, there was nothing over there for recreation or the thing. So what will happen? They go to the drugs. Our most intelligent people we have got is our youth. And we should learn how to teach them. And people have idea that if we tell them about sex education or sexuality education, they will go haywire. People become responsible. If you tell them that this is a wire and you don't touch, you'll get a shock. How many people will do? Maybe 1 out of 100. 99 people will not do. So the sexuality education is a very important part. Wherever, whatever way you get, take a chance to do it. And I would say it will make a wonder. And you see, eve teasing, rapes are occurring every day because of the violence which has been shown on the TV, pornography. The every second word, in English movies, 4-letter word. And can you believe, being a sexologist for last 45, I have not used a 4-letter word in my life till today. Why you have to use it? There are so many beautiful words over there. And now the Me Too has come out. Marital rape has come out. So, now you will find so many. And when the first time in 1985, the 7th World Congress, one girl came to me from a girls' college. She wanted to read a paper on sexual abuse. And I thought, is this a topic? I never thought that, we have always learned how to respect a girl and these are all our like sisters. And I said, what is this happening? So anyway, she wrote more than 30 people. She got it, and presented paper. And Apurva, you'll be happy to know she got a first prize in 7th World Congress. And from
Oh,
that time
wow.
I'm seeing, and I see Calcutta, Delhi, wherever we see why this is happening. I think we need to introspect ourselves. We need to teach our youngsters how to behave, how to respect. And the classic example, this book which I showed you, Sexuality Education, Madam Dhanpanta Ki, she was a principal of one of the Bombay International School. So one day, just before the recess, some boy found a, sanitary pad. So he took it out from girls, this thing bag. He threw it to somebody and then they started playing like a catching a ball. And when the message went to her, she said, afternoon, all classes are cancelled. She came. She could have taken all those parents and she could have fired them. She said, nothing doing. I'll take a class. She explained them what is anatomy, what is physiology, what happens in a menstruation. She said, whatever bad words you say, please say. And she wrote down literally and said, do you wanted to say to your friends? And very next day onwards, whenever anybody finds that a girl who is in the period, then they will help her out to catch her bag. They'll bring her a coffee. So by giving education, nobody becomes haywire. You become much more responsible. And what happens nowadays, we hear, Baghdad mein itne log mar gaye. It pains me. When I went to Japan, they said first primary school, they don't teach anything. They teach how to behave in a public, how to cross the road, how to respect other, how to respect elderly. And this is how we need to change our whole education system. And sexuality education, it need not be a separate class. It should be interwoven. It can be taken from history, geography, or even as some incidents which has occurred in the paper. Bring it out. I think what you said is a very important. And there should be very, very absolutely fast track and remove them and put those. Otherwise, they go on. They are from rich people. They go on. The case goes on for 10 years, 15 years, and nothing happens. So I think we need to change our laws. And as you said, the best way to come out of the sexual dysfunction and what you call rape and such, negative side of the sex is sexuality education. It will act like a vaccine. And every home should become a university of spreading a good sexuality education. And people think when we say sexuality education, are we going to say penis, vagina, and intercourse? No. It is how you behave, how you respect. And that is more important about the sexuality education. Very important question you asked. I think it is at my heart only.
No, thank you so much, sir. And you answered it so greatly, so nicely, and so gracefully, sir. So this is what the importance of the sexuality education in India. But somewhere, sir, isn't it not ironical, sir? Because the country which gave the world the Kama Sutra, है ना, and just forget this sexuality education. Now, talking about the sexuality education, talking about the sex is such a taboo in a country where majority of old temples, whether it's a Khajuraho, whether it's a Sun temples, they have erotic pictures because the temples are actually the site for the education. So definitely, sir, it's really a very ironical to have this, sir.
What you are saying is a very right. It was a Kama Shastra was a complete Shastra. I found 35 books on it. And till today, what Vasayana, the real book which is there in Sanskrit, it is very difficult to read and interpret. I can tell you, 100 brilliant people, all sexologists can come on the earth and sit together. They won't be able to concise and what? And he was a Muni. As you rightly said, in our Geet Govind, or you see Kumar Sambhavam, where the beautiful story of our Shiva and Parvati has been shown, The third is, as you rightly said in when I was doing a work for this exhibition, that we know only Khajuraho, Konark, Bhubaneswar, Aihole, Badami, Patadakkal, Modera, Sun Temple, which you said, Ambernath, and you go to any temple which is ancient, you may find at least one erotic sculpture over there. And when I'll tell you, when I went to Ambernath, what I found over there, it is about 60 kilometers away from Bombay. It's a Shiva temple. In the Garbhagruha, there is a linga and yoni, which we do the puja. And then when you come out, there are erotic sculptures. So I saw a married couple went to take a blessings that we will have an early child. And they were watching. I said, these are the first world's sexuality education galleries on the earth. And we were never, but what happened? More than 7 to 8 people, they came, we were constantly under invaders which came from abroad. And lastly, for so many years, we were under Mughal and Britishers. And both of them, Britishers, no sex, please, we are Britishers. And that was during Victorian era. You'll be surprised. Even legs were not kept open of a furniture. And if a female had a problem, they'll bring a doll and they'll say, where is the problem? Because only after the First World War, the Victorian era was thrown away. Otherwise, a good girl is supposed to get married, being a baby producing machine. The moment you think of sex, means you are not a good girl. These were the things which are happening. So very, very rightly you said. I think it's a very important point you brought out, that we have gone through this, and that's why, and now it has gone to other side. The type of things are available in our children's hand, in our people who are working, our domestic workers, and our people who are in the, our helping hands, which are there in our society or other. They have much more porn than what you and I have on their phone. So this has created another problem. It has created such a misinformation. And I get out of reading the Google, seeing the YouTube, seeing the porn. Many women, they are bringing their husband and says, look, sir, he has a problem. He's not able to give me orgasm, or he doesn't know what is my G spot. So the things have gone to other side. I'm happy that they are becoming more aware, but they should not get a knowledge from such a place. They should come to the expert like you people, obstetric and gyneco, if they have any problem, and come and ask you, okay, sir, how much it should last, what should be position, who should initiate, whether, 33% of the women, Masters and Johnson said, they never reach an orgasm. So this thing should be told, because while they think of multiple orgasm, which all glossy magazines now, every month, they are at least one article, which is a cover article on sexuality, and they create such a amount of hype. Today, if you want to sell anything, whether it is a coffee or car, it's with the female body. Just see. We are becoming, the body centric, image centric rather than the relationship. And relationship is a very important thing. As I said, on the dogs also, they do reproduction. Recreation they were doing in America, and what happened during HIV/AIDS, But what is important is a relationship. It is for the lifetime. What we say in the Saptapadi, you be a friend for the lifetime. And that is what message is. It's a very beautiful thing, sexuality. And it's not between the two legs. And let me tell you, leave aside you. In 2004, I gave a sexuality yesterday, today, tomorrow, and on a platform, 56th annual conference, 2000 psychiatrists, where I was the only family physician. And even they were not touching this subject. They thought it's a taboo. And I said, look, sex is not between two legs, but between 2 ears. And the brain and your learning and your mind has lot of effect on it. They had a geriatric psychiatry, child psychiatry, military psychiatry, forensic psychiatry, social psychiatry, rehab psychiatry. This was orphan. And I said, why it should be orphan? And believe me, this was after 7 years, I got a chance. And then they have taken it up, me, Dr. T.S.S. Rao and Dr. Mrugesh Vaishnav. T.S.S. Rao is the recent president of psychiatry coming. Mrugesh was a past president, and we have worked together for 7 years and broke the taboo. And now JSS Medical College has started a certificate and first time diploma course. And first clinic was inaugurated by me 23 years back.
Yes, sir. That I got to know,
Secondly,
sir. Yes, sir.
Dr. Vasan's, medical program, Dr. Rupin Shah, another amazing person, urologist, Dr. T.S.S. Rao, Dr. Samshu Ahmed from Bangladesh, and Dr.
Bangladesh.
Peter
Yes, sir.
from this thing, and myself. We have made things available online, so people can go and do those courses. And now I'm happy that you have taken it up. And the OBGYN and Fogsi, I'm telling you, you are going to go like a wildfire, and you will make each and every person you come to you. And once you teach one mother, she can be more than 100 teachers. So you don't know what will be the effect,
Correct.
the effect
Absolutely,
of
sir.
what
Thank you
you
so much.
teach to one
Yes,
person.
sir.
And that's why
Absolutely, sir.
first you will have to be confidential. You will have to learn some things from the books and also workshop. Suppose you learn on how to do laparoscopy, and do you think you'll be able to be successful? No. When you hold a laparoscope, you will find that how difficult it is. So I would say make more workshop, make such things. These are excellent way. This is the first line of you have taken a takeoff, but don't stop here. In fact, I had written a chapter on OBGYN for the psychiatric problem. Same thing, OBGYN and sexual problem, we can take it up, that problem. And I can help you out on getting all the best people in India and across, and you can come out with a handbook. So how to go about it, I think that is what is the need of the day. And I'll be the
Absolutely, sir.
happiest person to help you out in any way as far as that is.
Absolutely, sir. Absolutely. I know, sir. Sir, when you are talking about these pictures, about the sculptures, sir, I got to know when I read about your wonderful exhibition, Erotica.
Right.
So this, when I learned this topic, this word now, it is so exciting for me that what actually this is. And sir, I just want to know how you just correlate this sexuality with the art and everything. So can you just insight what is exhibition erotica? Yes, sir.
As I told you, even if you see, I was a editor and emeritus of sexual medicine, and this Yakshi which you see, it's the most beautiful female body on the earth. It is second BC, Moria, full life size. Right now it is in the new Patna Museum, and I am in love with this. People talk about Mona Lisa, Venus. They have not seen this. So and that was lying in the near Patna in Didarganj area. They were washing the clothes, over it, and suddenly somebody realized that this is and till today, it's amazing. In 1980s, when she was sent India abroad, this thing, festival, 16 crore rupees was there, her insurance, her nose was broken, and then they said, we will never give anywhere outside such an important thing in the life. I'm in love with it. If you see that, if you go to Patna, go to the new museum, and I have written a lots about this is one thing. But if you go to any corner in a Khajuraho, I read a paper on it, Khajuraho Symphony in Stone at Heidelberg in 85 when I was at Heidelberg, Germany. And I tell you, Geet Govind, Krishna and Radha, the most beautiful way they were shown, and you go to the Orisha, and at night at Orissa and Badrinath, this so-called erotic, that's why they were not allowed any temple of Vaishnav temple, but at night that they are allowed to sing those things over there. And I can tell you, I was searching, and luckily I was in Badrinath, and I heard that you can take a ticket and go to the Garbhagriha at night shrine time. So the Nambudri Bath, Pujari was there. He was removing one by one clothes, Naulakha har nikala. And then Tulsi Mala, which we call a Vaijanti Mala, she threw, and it came on my neck. I can tell you. So Shringar Ras, as I told you, my first, also I showed, somehow or other, I was a very dull student, I told you in the beginning. It was difficult for me. So I see I am sitting somewhere else. If that boy understand, everybody will understand my talk. And that is how I have started. And Shungar, I tell you, it's an amazing thing. There was a one book, Sanskrit book, and can you see first night? Now all of us has passed first night. What happens with the rains of kisses? The lips become very thick. And then every time you try to kiss lip to lip, you get a pain. So then what to do? So they said the writer comes to the help of this two character, and he says in the next complete second act, there was not a single word which was austere, that is pa, pa, ba, ba, ma. All dantya and other words. Can you believe so beautifully this? So when you read about this, you will go mad. And Khajuraho, a 500, when I went first time in 82, 83, 5,000 people, small village, two boys were touching. And today you go and see whatever you think on the sexuality, even as I said, sex therapy book, I have cover page, I have taken this complete, is a small little 2 feet by 3 feet, this thing. Orgy has been shown over there. Oral sex, anal sex, normal sex, and in between, they are bonding with some things, Vajikaran. So leave aside this. Vajikaran means making some sex, aphrodisiac thing with which, you can last like that of a horse. So we had a very rich culture. And that's why I love to associate myself with the erotica. And first time I saw in the world it was done ages back in Norway, Sweden with the public money. But on Indian things, first time it was done by me in Taj Palace. And as I told you, we were worried. I can show you those papers. We had undergone Indian Penal Code that if somebody आके बोलेंगे ये विभत्स है और इनको लेकर जाओ तो उसके लिए मुझे बेल पे छोड़ाने के लिए तैयारी रखा था. So it is not an easy job. Now it sounds easy. You click and everything is available. But for a small thing, and that's why if you go through my book, I've seen nobody was ready to give this. And that syndrome, Dr. NHB wrote, nobody has said about that. They thought it's a Bangladeshi syndrome in London. It was named at Bangladesh. And what happened? People from Bangladesh, from India, Pakistan, and Nepal were staying in the east of London. They were a little poor, this thing. And they found suddenly in Skin and Vedi, Roden and Godalmere, patients are coming and they are worried, they are feeling weak, tired, listless. So what is happening? And then they say something is coming out, white substance. Then they tried to do this test and then ultimately they given him prostatovesical physiological overflow. They could not get that syndrome. And our friend brought that syndrome and they say the Swapna dose. Only one place they say Swapna Bogan or nightfall or nocturnal emission. It's normal thing. And if it happens, people are worried and then everywhere board likha hua and they think you have masturbated. So astamaithun kiya hai, khatam ho gaye. So we need to first educate it. And then counseling. That another thing I tell you, you must learn. We have never been taught in a medical college how to do counseling. Particularly, if people are so busy with the operation, take out 2 minutes before operation and 2 minutes after operation and talk to the people. No negligence will come to you. Take it from me. It's a communication which I teach, people how to communicate, how to counsel. We never know how to talk to the people. Otherwise, they are very thankful people. It's our behavior which creates a problem. So I would say these are education, counseling, and therapy. And therapy today, sky is the limit. And what I do is a sex therapy. You'll be happy to know. You'll say, okay, what is sex therapy? Masters and Johnson started, they worked 11 years. And what they brought out was a sunset focus. Believe they were not able to use word sex. First two books, they have not used the word sex in human sexual response and sexual inadequacy. Then they wrote out pleasure bond, the third book where they wrote about word sex. And what they do, they give a treatment. Suppose if I have to learn something, delivery, do you think by reading I can do it? I have to come and be under you and you will assist me. I'll assist you and I'll learn the things. Same way, it's a skill giving the things. So whenever there is a maladaptation, there is a sexual disorder, sexual dysfunctions, they are not diseased people. What they need to do is to learn who will initiate, what can be positioned, how it can be done, how long it will last. Every time, same erection won't be coming. Are there any, problems like diabetes, blood pressure, any drugs effect, any depression, any thyroid problem, or they are in the what age they are? All those factors comes, and hygiene, or worried about the fertility, worried about HIV/AIDS, worried about the child which is coming, which will be abnormal. So we have to see it in a complete packet. Don't try to see. So I would say take out one day and then say during this day at 1 hour or 2 hour early, I come and I only see sexual medicine. And 1993, myself, Dr. Vasa, we did a 15 days workshop at Sri Lanka. 25 years are over and they started one day in a week and now they've gone into full-fledged. So I would say, please take it up this.
Absolutely, sir. You very beautifully told about this, sir. Sir, just in a few lines, when you are talking
Before
about
you
the
say,
virtual things,
before you say
yeah.
about sex therapy, see, when the sildenafil citrate, and I have no saying that Viagra word, which we know it is a drug of the century. 4 drugs which are created change the life of the mankind. You know what are those? The first one was penicillin. Second,
Okay.
can you name? Insulin.
Okay. Yeah.
Third,
And
third you
third,
should
third
know
is
is a
Viagra.
oral contraceptive. And fourth
Acha,
is the
okay.
Viagra.
Viagra.
And
Okay.
you will
Okay,
be
sir.
surprised to know that people thought that this is a magic. Now it's a Rambana aa gaya, ye mila to sab problem solved. No, it's not
It's
that.
no.
A study which was done, they said 3,000 women in Japan, they said, we never felt Viagra doesn't make any difference to us. So there is much more than Viagra. So in Sunset Focus, which was converted, now they used to say, couple has to come. There's a first thing, there's nothing like uninvolved partner. If somebody has got a fibroid, you can talk to her and do the things. But if this is a sexual problem, you need to talk to the male. And how to examine male, I have created my own ideas how to do it. So in sex therapy, I have converted it into sexercise. There, 2 people were there, Master and Johnson, so male and female. So first the male will talk to male, female will talk to female. Next day there's a crossover, and third day there's a round table. And by that time they are being checked up, investigation, and then they teach. And first thing they say sexual ban, and then they teach how to go about. And I tell you, after 15 days, they have been given a small homework every day, and then they see that whether they have done, not done, how it has been done. And the focus is not on the sex, not on the intercourse. It is on sensuality, sensuality, and sensuality. And that is where the difference makes.
Absolutely, sir. Wonderful, sir. It was wonderful. And I think, sir, it's almost 1 hour and we are keeping talking. And I think we can talk for the whole day about these topics.
Can
Yeah,
I,
absolutely,
can I
sir.
share, can I share with you
Yes,
28th of the February, just before the corona, when it was, ये पूरा इंडिया में बंद कर दिया था, and 1st of the March at Pune, Sasun Hospital, 150 years BJ Medical College, their medical students, they had organized, and their doctors, 6 professors, head of the department, 8 medical college into 6, 8 into 16, 48. I was talking to them 18 hours, full 1.5 day workshop. At the end, I was so much energetic. And Mohan Agase, who was a Maharashtra psychiatric head, he came for a valedictory. He said, Raj, if I would have known, I would have not gone for the sitting, but sit down. The sex is one thing. You can go, because it's not one. It's not a physical, as I said. Many aspects, religious aspect, social aspect, literature aspect, paintings, sculptures, and it's a complete, it's a holistic approach.
Absolutely,
You
sir.
cannot just, and that's I said one line of Master Johnson, sex is a physical act, while sexuality is a dimension of personality. And real sex, I may not talk in a 3 days workshop on intercourse or penis and vagina. It's much beyond that. So much beyond that is what animal dogs are doing every day out on the road, particularly on the rainy season. While we do it, they say dogs are doing it in season, we do it with reason. So let's understand that. And let's just spread the message that sexuality is the most beautiful. And you are so wonderful. You could make me very
Sir, it's due to you, sir. I got energy from the energy which you have at this age and with the practice of more than 4.5 decades, sir.
I am happy nowadays when I go to the conferences, and they give me legend award and most inspiring person and all those things. I've been made a emeritus of CSAPI. Some of them, when I feel happy, my mother or my father told that you go and attend. So second generation has started coming in. So I say a Chinese proverb, a beautiful Chinese proverb. They say, okay, if you put a seed right now, after 30 years, it will grow into a fruits, like, if you think of mango. So we have lost that 30 years back. Now it is again a right time, tomorrow onwards. And I remember Osho's words, sex, never repress it. Never go against it. Rather go deep into it. Go like an explorer. Explore all nooks and corners of your sexuality. You'll be surprised and you'll be enriched knowing your own sexuality. So once you go through, you yourself will be very happy, and you are not making, suppose if somebody comes with a problem, you are teaching that person and it becomes all right. But here, the partner, two family on two sides, and we will be able to avoid lot many divorces which are occurring today. Majority of the causes, the problem is on sexual medicine, and these are easy to treat. Erectile dysfunction, premature ejaculation, vaginismus, dyspareunia. Today we have got so many things. There are medicines which are available. There are intracavernosous injection available. There are pumps available. There are operation available. Stem therapy available. Gene therapy available. Shortwave, shocks available. And sky is the limit, I tell you. I go fortunately with a stem cell. Many lectures are there, and vaginal rejuvenation and functional. And I tell you, I'm surprised. I'm learning. So one thing you must remember, keep yourself open as far as the sexuality is concerned. Your 1001 case will be a new case, and it's a very dynamic thing. And that makes me keep young every day.
Thank you. Thank you so much, sir,
Yes,
for
thank you.
wonderful podcast. But before that, sir, just three rapid fire questions, sir, before we
Oh,
end up. Oh,
done.
yes, sir. Sir, first, masturbation causes sexual dysfunction. True or myth?
Myth. First of time, one line, if I allowed to explain little more, one line. Once upon a time, it was considered sin, it was considered a disease. Not only ordinary person, but the Surgeon General of the USA believed. And they were a machine to make how to stop masturbation. And you will be shocked to know, every day in the morning in hotel which you eat, 5-star, Kellogg's, cornflakes, they were made as anti-masturbatory, this thing. And they were gadgets. And today, one which was a problem, now we use it as a treatment of the sexual dysfunction. So masturbation is a very normal, healthy process. Only thing is bad when you get hooked to it. That is a bad.
Absolutely, sir. Thank you so much, sir. Substance abuse. It increases the desire or performance, or it decreases it?
It gives you a false feeling that you are doing wonderful. It takes away action. It may increase, it may relieve the inhibition. So Shakespeare had said long back about the alcohol, it increases the desire but takes away the action. And any substance abuse, as you said, the word is abuse. It is not the drug. And not only that, even medical drugs which are there, unless you are very open, there are many drugs which can create a sexual dysfunctions, either in erection, ejaculation, despair, or painful sex and other things.
Absolutely, sir. So the last question is, orgasm is necessary for pregnancy?
What?
Many of my patients, orgasm is necessary for pregnancy?
101% no.
Absolutely.
No, not at all.
Okay, sir. So thank you so much, sir, for this wonderful discussion. And last, the rapid fire. I think our audience definitely get motivated from your lecture, and they get a lot of take-home message today.
Once again, let me congratulate and thank Fogsi, Madam Sunita ji, and you thoughtfully inviting me and giving me an opportunity. What we have not talked is the medical aspect of it. We have given a complete, a start, springboard. Maybe someday We can discuss male sexual dysfunction and female. And in spite of, because many of the gynecologists are women and they find it very difficult how to talk to a male. And
Talk
male
to a
are
male.
more hypocrite. It is easier for them to remain with the problem than to accept in front of any female doctor that I have a sex problem. So how to manage this? Those things I have created. And I have even created, we didn't talk about unconsummation of marriage, which is a major problem you are going to face day in and day out, fertility problem. So maybe next time. And मैं कोई
Thank you
गया
so
वक्त
much,
नहीं
sir.
हूँ, जब बुलाया आ जाऊंगा.
Absolutely, sir. Sir,
Thank
so
you.
this is not the end. This is the beginning. This is
Yes,
the
sir.
beginning of a new chapter, a
Absolutely right.
new, absolutely, sir, a new chapter and topics with
And
difference.
and
So
you
at
are
the last,
you are in
yes,
a
sir.
true sense Apurva, and you could make me so relaxed. I never thought that I'm talking. I was thinking I'm talking to you with a cup of tea on a college
Thank
canteen.
you so
Please
much, sir.
continue.
Absolutely,
Wish you
sir.
all the best
Absolutely, sir.
and
Thank
wish
you
you
so much,
all
sir.
the
Thank
talks
you. Thank you so.
doing a
Thank you so
very
much,
good
sir.
initiative.
Thank you so much.
Thank you.
Thank you so much, sir. So before just a vote of thanks to none other than but our dynamic and charismatic President Dr. Sunita Tandulwadkar, madam, behind all this podcast and behind this Gyan Pravah series. It's a wonderful initiative, and definitely the technical partner, our publishing partner, and none other than but faculty for today, Dr. Raj Shekhar Brahmabhat, sir. Thank you so much to everyone. Thank you so much to viewers for listening to
फॉक्सी के लिए मैं इतना ही कहूंगा कि बहुत सारे ऑर्गेनाइजेशन देखे, मगर ऐसा मैंने ऑर्गेनाइजेशन you said me 48,000 or 43,000 people over there.
43,000, sir. Yes, sir.
I think amazing. And all of you, as she madam said, you are working as a team, and that's what is required. I'm very
Absolutely,
happy.
sir. Thank
Take
you.
care.
Thank you. Thank you so much, sir. Thank you so much, sir. Thank you. Thank you so much. Yeah.